Hi, I'm Matt Bunty from the Cleveland Clinic, cardiology fellow. We did a study of looking at GI bleeding events in the HeartMate 2 population. We're excited to present this data of 139 patients, all HeartMate 2s that were analyzed from October of 2004 to June of 2010. All patients had at least 3 months follow-up. We excluded all patients with other forms of mechanical circulatory support, such as LVADs, BiVADs, HeartMate XVEs in particular. We used Intermax to define bleeding events in this population, and we used an analysis of repeated time-varying covariates in a multivariate modeling to evaluate for preoperative risk factors for these bleeding events. Our overall results were 81 major bleeding events among a population of 139 HeartMate 2 recipients. Approximately 20% of those bleeding events were related to upper and lower GI bleeding. The main results of our study that we hope to show were that GI bleeding events occur early, much earlier than we would have guessed before doing this analysis, which is why I think it's helpful and important. The median time to GI bleed was 33 days, and that was associated with the same time period for a high risk of thoracic bleeding, as well as ischemic and strokes and other forms of arterial embolism. Major risk factors for GI bleeding, I think, have more to do with Intramax score. A high Intramax score before surgery predicts your likelihood to have these GI bleeding events. GI bleeding events are common, and about a third of our patients had a repeat GI bleeding event. A first GI bleed did not seem to predict subsequent bleeding in statistical models using modulated renewal analysis. And bleeding events adversely affected survival, probably through a function of these patients receiving transfusions, which we know is a problem among the HeartMate 2 population. Transfusions are a bad thing, and that they adversely affect mortality. So the conclusions of this analysis were that GI bleeding events are common. Greatest risk occurs within about the first 30 days or so. That survival is reduced after these bleeding events, and that additional studies are really needed to explore some of the factors that are predictive of GI bleeding events. We hope to expand on the already well-established body of literature on GI bleeding, and wanted to more precisely characterize when these GI bleeding events occur, when patients are at risk for GI bleeding events. And I think this large table in the poster kind of portrays that these bleeding events occur over time, particularly in the first 3 months, but certainly they peak much earlier than we suspected.